What if you could see the intricate workings of the human heart? I'm talking chamber by chamber, beat by beat, before a baby's even born? Well, today we're looking at fetal echocardiography. It's this incredible technology that gives us a clear window into the very start of life, long before that first breath is ever taken.
And that question, it gets right to the heart of what's possible today. The ability to know, to prepare, to go from just hoping for the best to actually planning for it. That's not science fiction anymore. It's a complete game changer in how we can protect the health of a newborn.
It all starts with this tiny window, a chance to look at the tiniest of hearts and give them a healthier beginning. Okay, let's dive into this.
So, what exactly is a fetal echo? And, maybe more importantly, why has it become such a vital screening for so many families out there?
Okay, think of it like this. It's a super detailed blueprint, or maybe like a specialized sonar that's focused only on the heart. A regular ultrasound, that gives you a great general overview. But a fetal echo, it zooms way in, looking at the chambers, the valves, the major blood vessels, all with incredible precision, and all in real time. But here's the thing. The real power here isn't just about finding a problem. It's about gaining time. That crucial head start lets medical teams get ready, plan a specialized delivery, and prepare for treatment the moment the baby is born. And honestly, for most families, it provides this profound reassurance that a tiny heart is growing just the way it should.
Now, there's a specific window when this test works best. We're talking between 18 and 24 weeks. Why then? Well, the baby's heart is finally large enough to see everything clearly, but the baby is still small enough that their little bones don't get in the way and block the view. It's the sweet spot for getting the clearest possible picture.
So, who is this screening actually for? I mean, while anyone can be curious, there are definitely some key risk factors that often lead doctors to recommend it.
A doctor might suggest a fetal echo for a bunch of reasons, right? Maybe there's a family history of heart conditions or a maternal health issue like diabetes. Sometimes a routine ultrasound just shows something that needs a closer look. But it's also really important to know plenty of families with zero risk factors still choose to get the scan just for that extra layer of confidence.
I know, the term detailed heart scan might sound a little intimidating, but the test itself is actually incredibly safe and really straightforward.
It's really just a simple 3-step process, and it usually takes about 30 to 60 minutes. You don't need any special prep. A pediatric cardiologist just uses a probe on the abdomen, just like a standard ultrasound, to capture these incredibly detailed, moving pictures of the heart structure, and even its blood flow.
And this part is absolutely crucial, safety. This procedure is entirely safe for both the mother and the baby because it uses harmless sound waves. We're not talking about radiation like you'd get in an X-ray. It's completely non-invasive, no pain, and no recovery time at all.
All right, so the images are captured, the cardiologist has analyzed everything. What happens next? Well, the results really guide the journey from here, and there are 2 main paths forward.
So, you've got 2 main outcomes. In most cases, the results come back normal, which brings this wonderful, wonderful reassurance. But if a concern is detected, the path immediately shifts from uncertainty to action. The real power of the scan is turning that what if into here's our plan. It guides the family through counseling, any follow-up tests, and a detailed strategy for delivery and care.
And all of this, it really brings us to the core benefit, just the simple power of knowing. It's all about replacing anxiety with clarity and with confidence.
It really is about helping families take that first step forward with clarity, confidence, and expert care. Whether the news confirms everything is perfectly fine or it reveals a challenge up ahead, this knowledge empowers everyone to move forward with a clear plan, knowing they are doing everything possible for their baby's health.
So the big takeaway here is this. By seeing more and seeing it earlier, we are fundamentally shifting prenatal care from being reactive to being proactive. It really makes you wonder, doesn't it? As these windows into early development become even clearer, how are they going to continue to shape the experience of pregnancy and the very beginning of parenthood itself?